I'm Dr. David Hill, and today we're going to be talking about effective treatment for sinus infection. When we talk about sinus infections, we really need to divide them up into several kinds. The most common is plainly the common cold. It's just a viral infection that gets in the nose and the sinuses. The sinuses, by the way, are air-filled cavities within the skull. There's two here, and then two more pairs deeper in the skull at places I can't really point to. When you get a cold, viruses infect both the nose and the sinuses. And the good news is this is going to go away on its own. There's really no effective therapy for colds. If the cold is lasting more than 7 to 10 days, if there's a fever that goes on more than 3 days, or a fever that occurs later on in the illness after 5 to 7 days. Also, if the cold symptoms seem to worsen suddenly and severely after 5 to 7 days of symptoms, all those are reason to suspect that what you've actually got is a bacterial rhinosinusitis. In other words, now instead of a virus infecting the sinuses, there's a bacteria that's moved in and is causing a more severe infection. In children, these bacterial rhinosinusitis tend to respond pretty well to antibiotic therapy. They may also benefit from a nasal steroid spray temporarily. In adults, it's not nearly as clear that antibiotics make much difference in the course of a rhinosinusitis. Many doctors will still try to use them, but the fact is, if we look at the data, it's not at all obvious that people who take antibiotics, even for bacterial rhinosinusitis, do any better than people who don't. In fact, nasal steroids and nasal lavage using a neti pot and salt water may work just as well as, if not better than, antibiotics. Now, the last kind of sinusitis is a chronic rhinosinusitis. This is usually a process that's been going on for more than a month. And this is one of the great challenges in medicine. There are various surgical options that have been tried, nasal steroids, even systemic steroids, long-term antibiotics. All these things have been tried, but there's really no known slam dunk therapy for a chronic sinusitis. That is something you have to work with your doctor or your ear, nose, and throat specialist to address and try and figure out if there's a therapy that may be helpful for you. Talking about how to make a sinusitis go away, I'm Dr. David Hill.